Hello, everybody. This is Jay Del Vecchio on a wonderful Thursday, and we have a very unique presentation that I think will really bring some real teeth to your programming and how to approach, how to assess, how to do some really cool things. We have Cindy Senk here. She's been teaching with us in the Northeast for a long time and done some amazing things. Some of you may have been working with her and trained with her and got certified with her. So if you're wondering where and what she's doing, here you go. She's right in front of you. Welcome, Cindy, and it's all yours. I will say, gang, that I am going to unmute you guys, so you may ask a question. You can always send me one, but it's always better to ask it personally on it when it's happening in the presentation. So you're self-muted for now. Leave it that way, but when you're ready, unmute yourself and ask a question, and we will take it from there. All you, Cindy.
Okay. Hi, everybody. I'm really grateful to be here with you today. I'm very grateful to Jay and Witz for inviting me to speak about this very important and very personal topic for myself, which is adaptive exercises for people with arthritis. I've been a personal trainer in this industry for over 35 years, a yoga teacher, and I have numerous certifications in arthritis-specific exercises. And I'm really hoping today to share with you and offer you some demonstrations and really invite you to participate with me partially through the program so we can really start to feel and talk about how exercise can be such a benefit for people with arthritis. So grateful to you and taking the time out of your busy day to learn more and share with us in this experience. So thank you. So I'm going to start by talking about what is arthritis and how prevalent is it. We hear the term all the time. It's not just a single disease. It's really a way of referring to joint pain or joint disease. And we know the joints are where two or more bones meet, you know, like the knees and the hips and the spine. So basically the term literally arthritis means inflammation of a joint. And believe it or not, there are over 100 different types of arthritis and arthritis-related conditions. People of all ages, from young children to older people, all sexes, all races have arthritis. And it's the leading cause of disability in the United States. The average age of onset is 44 years. So a lot of times people think, oh, arthritis happens when you get older. Not necessarily true at all. The average onset is 44. And overall in the United States, over 54 million of us have arthritis. And this is doctor diagnosed arthritis. So I would guess that there are even more than that. There are even more people than 54 million with arthritis. 1 in 3 veterans have arthritis, and the Arthritis Foundation that I'm a volunteer with has just put into an agreement, a memo of agreement with the Veterans Administration to be able to serve veterans with their arthritis. So we're really excited about that. And as I said earlier, children, young children, over 300,000 children have arthritis as well. So it's very prevalent. But there's a lot we can do, to take control and to help our clients live very effective and functional lives with arthritis. So now the symptoms. Common symptoms, most times it starts with pain, right? Pain in the joints. Mine started with my back when I was 18, 50 years ago. So joint pain, many times that's the first thing people will notice. Sometimes there's swelling, stiffness, particularly in the morning, and that can start to get a little bit better during the day depending on how much people move. And there also can be decreased range of motion in a joint due to pain or due to the difference in function as the arthritis might potentially progress. Symptoms can come and go. Some of us have chronic pain and it's always there. Other times you might feel days, you might feel better and you might feel worse. but the symptoms can come and go, and they can also be on a spectrum of mild, moderate, or severe. Personally, I have been diagnosed with severe arthritis in my lumbar and sacrum of the vertebrae, in my hands as well, but my knee isn't as bad. It's more of a mild form. So you can have somebody with arthritis and have it in different parts of their body, and depending on, again, what you're doing with them as a personal trainer, that can affect your choices of exercises as well. So knowing as much as you can about your clients and what they bring to you each time, and we'll talk about some of those things that you can do a little bit later on. Severe arthritis can result in chronic pain, the inability to do ADLs, which are activities of daily living, dressing, bathing, getting out of the car, getting out of bed, all of that. And it can make it difficult if you have a lot of pain to walk or to climb stairs. So arthritis affects us in many, many parts of our day. And again, these symptoms that people have can stay the same, or sometimes they progress. It doesn't necessarily mean that if you have arthritis, it's going to get worse as time goes on. It does for some of us, for others it doesn't. So it's variable. And the more you can learn, like with anything we talk about with WITS, being able to really understand your clients, the more information you have in that dialogue with them will only help you to help them, to be of service to them with their particular condition. Another thing to know is that arthritis can cause permanent joint changes. These changes may be visible, but a lot of times you look at somebody and you don't know they have arthritis, not unless they tell you. And sometimes the changes are only visible on an x-ray. That's why typically if you go to a doctor and you have joint pain, that's one of the first things they do is x-ray that area to try to determine what's happening in the joints. Some types of arthritis not only affect the joints, but affect the heart, the eyes, the lungs, the kidneys, the skin, as well as the joints. So it's really pervasive. There's a lot of different things that can happen with arthritis again. So again, just happy to share this information with you so we'll all be more informed. So now I'm going to talk about the 4 different types or categories of arthritis. The first one being degenerative arthritis, and this is the most common and the one that you hear about the most often, osteoarthritis. The most common type of arthritis that most people have overall. That's the big one, so to speak. And what that means is the cartilage, the cushioning in the surface of the bone there wears away. And then you get bone on bone rubbing, and that causes pain, swelling, and stiffness. Again, can be mild, moderate, severe, depending on the the individual person and how their arthritis may be progressing or not. And over time, the joints can lose strength and pain may become chronic. I know personally for me, my hands are not anywhere near as strong as they used to be. I have to really watch when I'm picking things up because I drop things sometimes and I don't even know I'm letting it go. So things like that can, again, just be something to be aware of. You're handing your person a weight. You want to make sure that they can hold it safely, things like that. So the joints can lose strength, and that's where exercise comes in, which we'll talk about that in a little bit. Risk factors for the degenerative type of arthritis include excess weight, family history. There's a definite genetic link. My dad had it fairly severely. Age, and previous injury. So someone at an ACL tear or whatever that may be seen down the road as arthritis, showing up in the joint. Again, it's all variable, but those are some of the things that can happen. So weight management is key to people that have arthritis because we don't want to put undue stress on the joints that's already there. So that's, again, a key part of being a trainer, to be able to help our people with not only the exercise, but hopefully some of the weight management and some of the nutrition choices that they make as well. So degenerative, again, being the first and the biggest category. And the second one is inflammatory arthritis. Now this is more systemic. It affects more the entire body, where the degenerative type, you might find one side, the knee, the low back, the hip, whatever. inflammatory arthritis, excuse me, is more systemic. And what happens here is the immune system is kind of like on hyperdrive. It's not working properly, and it mistakenly attacks the joints with uncontrolled inflammation, potentially causing the joints to erode. And inflammation can also damage internal organs, as we said earlier, the eyes and other parts of the body. The type that you'll find in this category of inflammatory arthritis, the ones that you'll hear of most frequently are rheumatoid arthritis, psoriatic arthritis, which affects the skin, gout, which we'll talk about a little bit later, and ankylosing spondylitis, which is in the spine. And so those a lot of times are things that you'll hear or you'll notice that people might say that type of arthritis that they have. Researchers believe there's a combination of genetics and environmental factors can trigger this autoimmune response, which is what leads to the inflammation. Now, in the past, the Arthritis Foundation now does a lot of research, and that's what they primarily spend a lot of their time on with fundraising. In the past, we used to think that osteoarthritis, the one I just mentioned earlier, does not have an inflammatory component, but now they're finding with research that it does. So these are going to overlap. You might have somebody who has OA, and then one day they come in and they're having a flare. We're going to talk about that as well. And that means that they're inflamed and there's some inflammation going on. So that's a recent something in research just recently that they found out, which again gives us more information to help people be able to deal with through medications, exercise, lifestyle, all of that. So again, there's a lot to this. Continuing with the types, infectious arthritis. Probably we don't hear about this as much, but bacteria, viruses, or fungus can enter the joint and trigger inflammation. Examples of organisms that can infect the joints would be some things like salmonella from food poisoning, hepatitis C, certain sexually transmitted diseases such as chlamydia. We don't realize sometimes how some of these things can affect the joints. So that's very not common, but it can happen. So timely treatment with antibiotics is really key in helping to control the infectious arthritis, but sometimes the arthritis does become chronic from that, from the infection. And the last one is metabolic. This is uric acid that builds up and forms needle-like crystals in the joint. So you can imagine how painful that would be, right? Resulting in sudden spikes of extreme joint pain. And gout is the one that is connected to metabolic arthritis. Most commonly, gout can come and go, but if the acid levels aren't reduced, it can become chronic, causing ongoing pain and disability. Some of the seniors that I work with at the senior community that I'm the fitness coordinator have gout, and I've never had it, luckily, but they have extreme pain with it. And so it's something, again, just to be aware of if you have any clients that might have that as well. So it's kind of a quick overview of the 4 categories of arthritis. So you have, an understanding of really the pervasiveness, the prevalence of it, how common is it. And now we're going to be talking about our favorite topic in life, right, as personal trainers, which is exercise and benefits of exercise. And this is something that I can't stress enough in trying to help your clients understand that exercise is so beneficial in so many different ways. A lot of times when people are in pain, what is the first thing that they do is they stay still, right? They feel like if I don't move, I'm going to hurt less, but that is counterintuitive, because what happens is the less we move, the more we hurt, the less we move, the more we hurt. And so exercise is a powerful and effective pain reliever. This has been studied over and over again. And if you ask anybody with arthritis, more than likely 99% of them, I guarantee you, is going to say, yes, when I move, I feel better. When I'm choosing exercise that is good for my body, it helps me to feel better. So that can be one in, so to speak. If you have somebody with arthritis who's really hesitant about movement, you know, one thing that you can absolutely with certainty say is that it will help with their pain. It will help with their pain. And I can attest to that. That's why I move all day. It's when I stop moving that I feel my pain a lot more than if I'm still.
Oh, I got a question here for you.
Great.
This is from Margaret. She's asking about how does one reduce the acid levels to get gout under control? Now, I can tell you from my personal experience from, I don't know, 15 years ago, when I found out I had gout and that no one in my family had told me that the family has gout.
Yeah.
But it came on to me, it does wake you up in the middle of the night, I'll tell you that.
Yes.
But I take a medication for it, and it hasn't bothered me one single day since
Yes.
once it was in control. So, but you may have obviously some other thoughts on that.
Well, again, I'm not a nutritionist, but I know that there are, and again, I was going to talk a little bit later about the arthritis.org website, but the arthritis.org, Arthritis Foundation main website, arthritis.org, has wonderful, wonderful free, it's all free, tons of information about anything you want to know arthritis related. So Margaret, that would be a great place to look. But what Jay is saying, medication, nutrition, you know, dietary changes, things like that. Again, I'm not a registered dietitian, so I don't want to speak to specifics, but those are the things that I have personally seen people do that have helped them with their gout symptoms. But I would absolutely encourage you, any of us today, to go to the arthritis.org website, and you can just type in gout, and there are so many things that are going to come up in terms of podcasts and information and flyers and all kinds of things that you can look at. So great question. Thank you for that. I'm going to continue to move on here. Since we're talking about benefits of exercise, is the easing of inflammation. That again, we've talked about inflammation as being a component with arthritis, and the inflammation can help to be eased through some gentle movement. And we'll talk in a few minutes about the types of exercise that is recommended. Okay, but that's another really important one, that it can ease inflammation. Also, we can increase our strength and stamina, and I shared earlier, that's one thing I noticed personally as I get older and my arthritis has gotten more degenerative, that my lack of strength has been very, very clear to me in so many ways. So exercises and choosing what to do is really, really helpful in maintaining as much as we can of our strength and stamina. Because when the muscles around the joints are strong, right, the joints are going to be more able to do what they're supposed to do before the arthritis kind of attacked and invaded. So again, the more we can stay strong, pain-free range of motion, all of that is really important as well. We talked a little earlier about weight management. It does help weight management be a little bit easier because of movement, so that's another plus. And also helping with emotional health. I teach a lot of Arthritis Foundation exercise program classes, and you'll notice as people come in, it's like this community, right? They come in, how are you feeling today? How's how's the weather affecting your joints? All of that. So that camaraderie, that social connection, whether it's in a group, whether it's with you as the trainer, that's really important to be able to exercise and connect with others, and also helps our emotional health as well. So that's really positive. Increases function for ADLs, again, the activities of daily living, that many, many times is hugely affected by having arthritis. And this is another really important point. Studies show moderate intensity exercise is beneficial, not detrimental. People think, oh, my joints are already wearing away. I shouldn't move because it's going to wear them away more. No, it's not that at all. Again, it's about keeping strong, staying functional, all of that. And moderate intensity exercise is beneficial, not detrimental. And the last one I added, because I think this is really an important thing, it's an accomplishment. You know, it raises our self-esteem. Many times we have those days where we're like, oh, everything hurts, and you kind of get those why me moments, you know, but then you can go out and walk, you can practice some yoga, you can do whatever, get in a pool, whatever you can do, and our self-confidence goes up. You know, we have the power to help ourselves. And one of the mottos of the Arthritis Foundation is take control, which I love that. You know, we're not victims of our disease, right? We're helping ourselves by becoming stronger, by hiring a trainer from WITS, of course, to help us do these things that are going to help us to stay strong, stay functional, stay positive. And that to me is huge. The positivity, the emotional well-being, you know, all of that helps us to really be, you know, forging ahead each day with this particular challenges that arthritis brings us. And I'm sure you can think of other benefits of exercise, but those are the main ones that that we came up with, and that the Arthritis Foundation again will put out in their literature. But I'm sure there's many, many more that we could talk about as well. So now we're going to talk about what type of exercise is best. Now, this is some generalities here, and I know there's a lot of different things that people do. I know I was a runner for many, many years. Running is not on here. I'm not running anymore because the pain levels are way too much for me. But these are some exercises that are recommended by the Arthritis Foundation, rheumatologists, those are specific arthritis doctors, physical therapists, occupational therapists. So these categories of exercises are what is recommended. But as I said, it's you know, it's a limited list. I'm sure there's lots of other things that we can think of that people can do as well. So I broke it down into three categories: the cardiovascular, the muscular fitness, and then the flexibility and range of motion. So the first one, as we all know this, cardiovascular exercise to strengthen our heart and lung function and develop endurance. The types of cardiovascular exercise that are recommended by the Arthritis Foundation: aquatics. I know some people are not water lovers, but if somebody that you work with has any you know, ability to get in water, to get in a pool, do you know, a water fitness class, water walk, you know, float on a noodle and feel gravity just, you know, taken off the body. There's nothing better, in my opinion, than yoga and aquatics to help in pain management, at least personally for me. So aquatics is a really great one. Hot tubs, even with jets, anything like that can be really wonderful. Cycling, because again, there's not as much weight bearing. A lot of people with arthritis can cycle fairly, you know, well and feel really fine afterwards. The thing that I've heard people say is the bending over the handlebars can be challenging on their back after a while, but cycling can be great. And they have new adaptive bikes now that people can get where they're more upright. Swimming along with aquatics, but I just want to put swimming in a separate category because not everybody's a swimmer. There's a lot of coordination that goes along with it, but you can get the great benefit of the water by just water walking in the pool. You know, it doesn't have to be fancy swimming, you know, crawl stroke, breaststroke, any of that, just getting in the water. And the most important one, or the one that the Arthritis Foundation recommends, is walking, because most of us walk at least some part of our day, okay? And so I also added in here some specific programs that the Arthritis Foundation has developed that will help your clients and that you can get certified in if you have any interest in. I'll talk more about that later. But there's a Walk with Ease program, the Arthritis Foundation Aquatics program that go along with the cardiovascular part there. Okay, so there are two programs right there that you can learn more about. I have all these certifications over 20-something years, and it's something that I use all the time as a trainer. Out of all the things I've used in my lifetime as a personal trainer, it's the arthritis exercises that I use most often. Okay, so cardiovascular. So now moving into muscular fitness, and as we know, helping to strengthen the muscles and connective tissue and increasing bone density. So the types of activities here that are recommended is, and I have lift light weights. Now, that's going to be varying depending on your client, right? For me, a lightweight is not going to be the same as somebody who's younger or somebody who's stronger than I am, or any of that. So you'll utilize that, your knowledge and expertise, to determine You know, how much weight can somebody lift carefully and safely, and making sure, and we're going to talk and move in a bit, we're going to talk about how we can assess that, you know, in somebody's body. So lifting light weights, using resistance bands, and again, I'm going to be demonstrating these a little bit later. I'm just going to kind of run through them now. Water resistance, again, going back to one of my favorite topics, the resistance of the water. When you're in the water at rest, it's 12 times more resistive than the air. But when you begin to move in the water, right, water walking, doing whatever you're doing, there's more resistance and more resistance. And that can really help to keep us strong. The other really cool thing about the water is the compression in the core, really helping that vertical compression to strengthen the abdominals, strengthen the muscles in the low back, all of that. It can be so beneficial and pain-free for many, many of us in the water. And another thing that is recommended is Pilates. Now Pilates, most of you probably know what that is, but it does require in many classes getting down to a mat, and we're going to talk about that in a little while. Though I do teach a Pilates class, it's a combination core Pilates and yoga, where I do have a couple of the residents that I work with working from a chair. Okay, so it can be adapted, not everything, but there can be ways you can do that if that is called for and the client is more comfortable in a chair. So the programs here that I would recommend to learn more about this would be the Arthritis Foundation Exercise Program. Again, an excellent program that is evidence-based. These are all evidence-based, all of them. The Arthritis Foundation doesn't put anything out that's not studied and studied and tested and tested. That's why I'm such a fan of what they do, because they're so just thorough. You know, it's all very, very excellent information. And then the last component here is the flexibility range of motion to decrease the stiffness and improve range of motion in joints. So yoga, of course, I have to put that one first, right? I'm a yoga for arthritis teacher. Tai Chi is another great one. There is a Tai Chi for arthritis program. I'm not certified in it, so I didn't add that in, but that there is one out there, and you can get training in that if you have any interest in that. And then simply basic stretching, right, to that, the range of motion that they can do is really, really helpful. But there is a specific yoga for arthritis program that is developed at Johns Hopkins about 8 years ago. And I've been fortunate to study with Dr. Munaz, who developed that. And that program is excellent. So if any of you are yoga teachers out there, I would encourage you to look at that and see if that might be of interest to you. Yes. Now, this last part is really important. That's why I have it in bright yellow. People need to understand muscle soreness, right? The delayed onset soreness that people feel, you know, when they're exercising versus joint pain. And the reason I say that is because when people are hesitant to move, right? And then they start moving with you, and then all of a sudden their biceps a little tender or something, they need to be educated by you, by us, as to the difference between muscle soreness versus joint pain. And what I usually ask them is, before I even start working with them, is, you know, what does your joint pain feel like? Describe it to me. And most people will say sharp, shooting, very painful, etc. So you want them to have that in their head in understanding that pain versus the difference between muscle soreness. Okay, and that's a key difference there, because when you're moving and working with them and they're all of a sudden they start getting sharp pain in their elbow or their shoulder or whatever, that's again saying that's the red flag, right? That's not where we want to go. We want to be able to move pain-free, range of motion. And again, we're going to be demonstrating and moving in a bit. So that's a key thing to really have that dialogue with your clients about that. Okay, muscle soreness versus joint pain.
That's great, absolutely great, Cindy. I have a question here from Tim. He says, as a trainer, do you offer your clients any assisted / PNF stretching?
That's a really good question, Tim. If I don't do a lot of hands-on unless I really feel it's necessary, or unless I feel I have a really great rapport and, almost like an empathy with the person, because I'm always afraid that I'm going to push too far for them. You know what I mean? So if I have a client that is very aware of their body, very much able to describe to me that they know what they're feeling and all of that, absolutely, I have done that in the past. Do I do that a lot with people? No, I'm not telling you not to do it, but I think it's really critical when you're moving somebody and you have your hands on them for that dialogue to be there. That combination of them giving you feedback, you giving them feedback, because that's really key, because we're not feeling what they're feeling. Okay, so I don't know if that answers that, but I just wanted to
Yeah,
mention.
that's great.
Okay.
Great.
So now I'm going to invite you to begin to move a little bit with me, okay? And before we do, so I'm just going to push back my chair a little bit more. And if wherever you are, if you'd like to do some of these gentle movements with me, I would really love to have you try some of these. This slide is called best practices. And so what I did is I took the best practices from the Arthritis Foundation exercise program, the Arthritis Foundation Aquatics program, the Walk with Ease, and the Yoga for Arthritis. And I kind of put this bullet list together of about 5 things that really I think would be beneficial for you as a trainer to consider, with working with your clients, okay? And some of it you might do and some of it you might not. So again, I wanted to, bring this to you, but also invite you to move along with me, okay? So the first one is called the joint check. And in any arthritis class that I teach, we do this at the very beginning of the class, okay? And I'm going to run you through a few movements here. Now, you don't have to be Arthritis Foundation exercise program certified to do a joint check. You're going to see the movements that I'm going to offer you in a minute. And any of us as trainers know these movements, but it's just a matter of choosing them, being mindful, and really having the client take a minute to notice how they feel, and then begin to move very carefully and very slowly. Okay, so we're going to start with a little bit breath practice to kind of just allow ourselves to kind of get into our bodies a little bit more. And this is going to be a breathing technique with a longer exhale. And what that does is it taps into the relaxation response of the body. I learned all of this in Yoga for Arthritis and in yoga teacher training, and be able to really help to tap into the rest and digest part of our nervous system, right? And so this can be really helpful. So what I'm going to demonstrate from the side here, if you'd like to try it with me, and I'm demonstrating this with a flat back going forward because it's safer for the spine to bend with a flat back first and then maybe round the spine if that's okay for the person. They don't have osteoporosis or osteopenia or whatever, but flat back first is really safer. And then as you get further down, you can invite rounding of the spine if you choose. But for this particular breath practice, it's called a relaxation mindfulness breath practice. We're just going to keep the back nice and flat. So taking the hands to your table or to your legs, on your inhale through the nose, lengthen and inhale, breathe here. And then on the exhale, we're going to bend our elbows. We're going to exhale through the mouth. Release as much as you can until you feel a stretch in that low back or in the back body. And then when you're ready, you're going to slowly come up, press the hands into the legs or to the surface beneath you. Lengthen up again. I'm only going to do a couple repetitions of each of these because I want to get through everything. And then exhale again. Maybe round the spine at the end of this, maybe not. And then pressing all the way back up again. Coming up slowly so you don't get lightheaded or dizzy. And I usually do that about 6 to 8 times with people, but I'm giving you the short version of that. So that's a mindful relaxation breath practice that what I do that first to help the clients settle in and notice how they feel. So now the joint check, and I'm probably going to run through like 4 joints because like I said, I want to make sure I get to everything else here. So we'll start with the upper body. So I'm inviting you to sit up nice and tall in your chair. Now I always recommend, if they can, to have their back away from the back of the chair, if at all possible, because that's going to engage more of their core muscles, especially if they have arthritis of the spine. That's going to really help them to practice their posture and all of that. So if they can do that, even if it's for 30 seconds or a minute or so, and then they may need to go back, it's all good, okay? So what I always say to them, whatever they can do is perfect. So sitting up nice and tall, we're going to do a joint check of the neck, a little bit on the shoulders, and then a few on the elbows, and then we'll move on. So find that lengthened spine, take a breath in, and we're gonna move from the neck up and just slowly turn your head any way, right or left. Just notice how far you can go. We don't wanna push anything. We don't wanna go to sharp pain. Just go to where you can. Pause for a moment here. Continue to breathe. Doesn't have to be the breath practice that we just did, but continuing to breathe, and then slowly come back to center. Pause. And now we're going to do the same thing on the other side. So notice this side compared to the first side, not in a judgmental way, but in a way of information. Okay, information. How's my neck moving today? Okay, and I may do a couple of those per side. And then another one that I do for the neck a lot is just tilting the ear to the shoulder. Relax the shoulder down, stretching through one side here, and then coming back up, and then the other side. And again, if you do this with your clients with arthritis, you're going to notice differences in their range of motion. You absolutely will. And then come back to center. Now moving on, and I know I'm going quicker than I would normally, shoulder rolls, any direction, just relax the arms, shoulder rolls up and back and around, or forward first, whatever they choose. And then whatever way they're moving, I invite them to stop and then move a different way. Okay, move a different way. Just inviting that nice warmth into the joints, noticing how they feel. Good. And then from there, with the shoulder, what I usually do is I invite them to bring one arm up and go up as far as they can, pain-free. Okay, and that's really good information for you to know, because maybe today in your program you had a lat pull down, right? And their shoulder is not happy going any higher than this. So these are things, again, as a quick check, you can be able to say, oh, I might have to adjust this or adjust that, okay? So gentle shoulder flexion. I usually stay within sagittal plane range of motion and joint checks. And then the other side, and again, notice as a trainer, is one side different than the other? You know, how are they feeling? All of that. Now, Tim's question about hands-on a little bit earlier about the PNF, one thing I never do is I never take their arm and go, oh, let's see, how high up can we go? That's not at all acceptable in my opinion. I don't know their pain. I may be causing them extreme pain. They're the ones that know how they feel. So it's not something that I would, do. And I'm sure none of you would either, but I'm just mentioning that, okay? So just a few for the shoulders, and then the elbows. Again, I'm not going to get to the lower body, but I'll get to that later. So you bring the palms, extend the elbows here, palms facing front, bend the elbows up, palms facing the body, flip the palms down and press down. So now we're checking in with the elbows and the wrist. And the wrist we'll talk about is a lot of our people with arthritis at the wrists and in the hands. Okay, so in the joint check here, again, I'm giving you the very quick version here. Any movement like, knee extension, flexion, any kind of movement, that one we did earlier, bending forward and coming up, all of that would be really valuable. A joint check takes 5 minutes maximum, but it's going to give you invaluable information as a trainer to then say, well, maybe I need to redo my program today. Maybe we don't do as many shoulder movements or whatever it may be. So I really recommend a joint check to you. Now, the second one is gradual range of motion. We kind of already alluded to this, if pain-free. So increase only if pain-free. So if I'm coming into shoulder flexion and all of a sudden I'm getting pain, it's like, that's it, right? I'm not going to go any further, and then I'm going to come back down. Sometimes people will come to you with a flare, an arthritis flare, and this is an exacerbation of symptoms, okay? I've had a couple flares in my lifetime, and they can knock you out, believe me. They can be systemic. You can have the whole body feel like you have the flu and all of that. So recommendations for exercise during a flare, if they come to you, is really decreasing the range of motion, making the movement smaller, doing a lot of breathing, nothing too intense, but the more you can move and breathe and relax, then that many, many times can help people to feel better during a flare. Most rheumatologists will say movement is a good thing during a flare, just decrease the range of motion, okay? So for example, if my knee was having a flare here, maybe what I would do is instead of doing an extension and then a flexion, what could I do is just do a little bit, right? A little less, and then feel. Sometimes as you move, you start to feel better. That happens a lot to me in the morning. My back is really challenging in the morning, but the more I move, the more I feel, and then I can start to move in ways that I couldn't when I first got up. And we've also alluded to this one, another best practice. Trainer and the client are in a partnership, okay? Respect how your client feels and make changes as needed. Empower the clients to listen to their bodies. They're the experts. They know how they feel, okay? Please don't be, and I know you're not, but I'm saying this anyway, please don't be one of those trainers that knows everything, right? Like you know better than they. No, they're the ones that are the experts, and they need to be empowered to really own that, because they're the ones that feel what's going on in their body, not us, right? They do. So I think that's a really key partnership, the whole thing about partnership. Oh, and this is one of my favorite best practices, the bus stop method. I learned this from a yoga teacher, Diane Bondi, and I love it. So basically the bus stop method is you're going to kind of gradually add more movement possibly, but they can get off the bus anytime they want, okay? So I'm going to start with isometrics. So if pain levels are fairly significant, I'm going to demonstrate this with the lower body here. I'm going to stand so you can see me. If their knee pain is really significant that day, and that you can do this in a chair too, but I'm standing so you can see me better. You could have them start with straight leg lift, right? You could be in the chair and just lift and lower. So now there's no movement in my knee, but I'm strengthening those muscles. Those muscles around the knee joint, right? And then if they say, oh yeah, Cindy, this feels okay, then I might start with partial range. So I might extend a little bit out, and then a little bit back, right? Partial range of motion here, just gentle, easy, easy. And then they can get off the bus there. Maybe that's what they can do today. And that's, again, perfect. We never want to judge them. It's like, rah, rah, you know, whatever they can do is great. And then maybe they can do a little bit more, you know, maybe they can do a little bit more. So the idea of the bus stop is, again, empowering them to make the choices of, yeah, I've had enough of that today. I think 8 repetitions is good. I don't really feel like I can go to 12, whatever it may be, getting off the bus at any stop, right? And then the last really key one is the 2-hour pain rule. And you'll find this in any arthritis program. Basically, the 2-hour pain rule means that they're done training with you at 1 o'clock in the afternoon, right? At 3 o'clock that same day, you're going to try to remind them. Maybe it's a text message, maybe it's a quick email. Just to, over time, they'll start to get used to this, but 2 hours after they're done exercising with you, ask them how they feel. You know, have them do a quick assessment. Maybe they overdid a little bit on their lower body or their upper body or whatever, and that can help you the next time you see them to help tweak and adjust the program. So the 2-hour pain rule is, again, really a good one to utilize with people, because it gives them, a lot of times they feel better after they leave you. Most times they do, but 2 hours after that, kind of check in if possible, or even have them put a reminder on their phone or whatever to just notice how they feel 2 hours after they're done. Okay, so those are some best practices. I know I'm going fast, but I'm trying to get through all of these things that I want to share with you today. Okay. So now, arthritis-friendly equipment demo. Okay, now, and I have some of my fun paraphernalia here. So I'm going to start up in the chair, and then I'm going to eventually move to the mat. I could talk for 3 days, but I won't, about chair versus mat. The chair is our friend, and it can be really a good thing. If your client is really having a lot of pain in their knees or hips that day, and you wanted to work on the mat, first off, the first question is you always want to ask them is, after you do the joint check, how do you feel? Do you think you can, is it going to be okay for you to go to the mat? And more importantly, can you get up? And there's a whole thing that I can teach you, not today because we're running out of time, but how to get from a chair to the mat without using the knees, how to use props, all of that. These are all things we teach in the programs, and they're really beneficial. So the idea of keeping somebody more upright and not coming down to a mat, perhaps, if that's in their best interest. So I always want to mention, I'm a huge fan of chair yoga. I don't care what any yoga class I'm teaching, I have a chair there available if anybody needs it for any supports. That's another passion I have, is chair yoga and yoga for arthritis. Okay, so now moving on to equipment demo, I have here tubing. And I've also added on the slide where I got this stuff. I don't sell it, I'm just telling you the stuff that I like and that I use. And one thing I find really helpful, especially if there's any arthritis of the wrist, the CMC joint in the thumb area, this can be really painful to grip, right? The idea of tubing with a padded grip. So I want to show you the difference between, these are both from Spry, but see the handle that doesn't have the padding, and then the handle that does. And the padding handle for me is really, I use these all the time, really easier to grip, more comfortable to hold. Sometimes weightlifting gloves on their hands can be helpful as a little extra buffer, you know, when they're squeezing or holding something. But padded, any kind of padded handles or grips can be really, really useful. Soft grip handheld weights. Again, one of my other favorite things here. You can Google these and get these anywhere. They're beanbag weights, okay? So here's a regular weight where it's gonna really take me a lot to get a grip on this and hold it. And notice how much, you know, I have to have a closed hand, right? Whereas with this one, I can have the weight right in my open hand. I can do whatever I'm gonna do with it. I don't have to grip it as hard as the other ones. And these are wonderful. They're developed by an occupational therapist many, many years ago. And they have all kinds of different weights. These are 5 pounds. They go up to all these different ones you can purchase. They're not cheap, but they're worth it. And I really, really love these. They're about 10 years old, and you know, I use them all the time. So soft grip weights, really, really a nice thing to have. Okay, Fit Simplify bands. These are another one of my favorites. They come in different colors and different resistance. And this is something the Arthritis Foundation exercise program recommends that we use for people in class. So for example, if I'm going to be doing any kind of movement, I would just take the band to whatever, you know, strength the person would use, place it around their wrist here, so there's no gripping of a weight or holding anything here. And then perhaps I would just press in and do, for example, a seated movement of a row here. If their back feels, what am I trying to say, strong, I can bend forward a bit and do a little bit more on an angle. But there's a lot you can do with upper body, lower body with these Fit Simplify bands. They come in packs of five bands, I want to say. Relatively these are all reasonably priced things. You can also use them on the legs as well, lying down or sitting and moving through the hips and all of that. So these I like a lot as well. And now for the last 4, I'm going to move myself down to the mat, and I'm going to take the camera down. So hopefully Jay and I already did the run through so you can see me, because I want to show you a couple more things about kneeling, wrists, and straps for stretching, okay? So bear with me 1 second when I move this over here, and I'm gonna move my camera down. So hopefully you can see me over here now on the map.
That looks great.
Okay, thank you. Thank you, Jay, my helper. So now, kneeling pads. Oh, let me get my paper because I can't see it that far away. Kneeling pads are my friend, believe me. I love, this is a simple gardening pad that I find really, really, really helpful. If you have in the gym, a lot of times you'll see these Aerex pads. These can be wonderful to kneel on or even sit on. Again, can really help somebody to feel better. But if someone has knee arthritis, it is very challenging for them to kneel many, many times. So something like this, having something padding, can be really, really helpful, okay? For those of you who may be yoga teachers, and I know I digress for a minute, but one other thing you can do is bring something behind their knees, for example, if they're, for example, in a child pose or puppy or anything like this. Again, it reduces the angle on the knee, right? So there's less flexion on the joint. And that can be, again, a pillow or a bolster, anything like that can be really, again, a beneficial thing to be able to use. Kneeling pads and gardening pads, you can get them anywhere that they sell things like that. One of my other most favorite pieces of equipment is a stretch out strap. OPTP makes it. And I love this one because it's got loops. Okay, if you can see the loops. And so on the days that it's hard to grip, what can you do is you can have them put their wrist through the strap, right? If I'm doing, I'll stay seated so you can see me. If I'm doing like a hamstring stretch, for example, and I don't want to hold onto the strap with my hands, I can simply take my wrist through the strap, and do it again. I'd probably be on my back, but I'm not going to go there yet. But basically here, this is a really hands-free way to be able to utilize a strap without having to grip it really tightly, particularly if the hands are fairly sensitive that day. Okay, so this is a stretch out strap. It's, again, one of my favorites. I use this all the time. Ankle weights. Now, I don't always use ankle weights for the ankles because a lot of times, again, we talked about this earlier, people having difficulty in holding things. So if you have somebody who really has a problem holding a light weight, for example, you could take an ankle weight and wrap it around their wrist, right? And be able to have them move with the weight. Now there's, again, no holding, no gripping. And these really are nice and soft. I really like these that I have. But again, can be really, really helpful to have somebody, and you can obviously use them on the ankles too. But the idea of again, I have a lot of people that I work with that are seniors who have a lot of trouble gripping, even a 2-pound weight, whatever. So this can be a great way they can still strengthen with it attached to their arm without having to hold something, okay? So I wanted to mention that as well. And then the wrists, the wrists and hands, very, very challenging for many of us with arthritis is the weight bearing. Whether you're doing, a quadruped on the mat, or whether you're practicing yoga, or whatever you might be doing, wrists can be really sensitive. So there's a couple things I want to share with you. One is my most favorite is the wedge. So you can see the difference between the thickness here and the thickness here, right? So what I do is I take it, I'm going to put it on the mat with the thicker side toward me, but what I do to make it non-skid is I put it underneath the mat, and then I put my wrist on it. But I'm going to take it off to show you, but that's how I do it for safety. And then from here, for example, if I'm moving through, for example, like a quadruped or whatever I may be doing here, the difference between the weight bearing on my wrist with the wedge and with my palm flat on the mat is night and day. It's so much nicer to have it just distributes the weight differently. And so that's a great way. Of course, you can always go to forearms. I rarely go to fists because a lot of people have hand arthritis and fists can be, I think, a little too much. But another thing I found really helpful is a soft yoga block, not a hard one, same type of thing where it's just a different way. The angle's different. It just makes a difference. I can bring my hands a little more to the edge of the mat here and moving in different ways from there. So wrists can be really challenging, gripping things, all of that. And so I just wanted to share with you a few things that I find helpful for me with my clients within the idea of the wrists and the hands as well. And then again, we talked a little bit about gloves, weightlifting gloves, things like that can be really helpful, particularly with this CMC joint here, really painful on a lot of us. So any pressure on that can be a challenge, but a thick glove with some padding there can be really, really excellent. Okay. The last thing I just want to mention is, again, I did talk about earlier, arthritis.org. Please, as a resource, it is a wonderful, wonderful resource for you. All those questions you asked me about gout and all those different things earlier, you can find information on the website. We have network of facilitators and connect groups throughout the country. There are support groups for people with arthritis. I am a facilitator for a group in the Springfield, Mass area where I live. There's educational seminars, there's podcasts. There's so much great information that's out there on that arthritis.org website. So please, I would really encourage you and your clients to look at it if you have any interest. And then the last thing I added was where you can get certified. If you're interested in more information about the Arthritis Foundation Aquatics and or exercise program, aeawave.org is the organization. AEA, the Aquatic Exercise Association, took over about 10 years ago the arthritis programs, and they manage them. So it's an online course that you take. You can get certified in both AFEP, which is the exercise program, and the other one, which is the aquatics program. And again, such great information for you as a trainer. So I wanted to share that with you as well. Yoga for Arthritis is a whole nother training. It's not through the Arthritis Foundation. Again, it's through Dr. Munaz, and she's in Baltimore. So I want to finish up, and I almost made it right on time. I also want to give you my email if you have any questions, or if you have a client you want to talk to me about or anything. I am of service to you, and I mean that. Jay and I talked about this earlier. I really want to be helpful and a resource at all if you need. So it's Cindy Senk, my name, at gmail.com. And I just want to thank you for supporting people with arthritis. I really am so grateful to have spent time with you today. Thank you.
Cindy, this was some amazing, especially those adaptations at the end. I know I love that stretch item there myself. I use that all the time, and it makes it easier to get different angles. Yeah, we have here from Charlene. She loves the wedge suggestion, and we have a question here for you too. Let's see. Your opinion: exercise vibrator plate and arthritis, beneficial or not?
Oh, good question. I have not personally used it, okay? But when it comes to anything, and I think, does that have to do with balance? Am I guessing right or not? Or am I wrong on that? Because the vibrator, if it has anything to do with balance and challenging balance, I think that's really important, but I don't feel like I know enough about it to speak about it. But if it has anything to do with balance, I'm 1,000% for it, because one thing I didn't mention is that our balance gets affected, the joints gets affected with arthritis, and it can really affect our balance as well. So I'm sorry I don't have more knowledge about that to speak more intelligently about it.
Yeah, Paula was asking about it, and I would say, Paula, obviously you can share with her email. Why don't you give us your email again, and I'll of course also put it into
sure.
The little newsletter you'll get, not newsletter, the email you'll get from us with your recording and your quiz. Remember, you have till Monday at 5 to fill that out, guys. But I'll put her email in there as well. But in the meantime, go ahead, Cindy.
Okay, yeah, it's my name, Cindy, C-I-N-D-Y. Last name is Senk, S like in snake, E-N-K @gmail.com.
Beautiful, beautiful. Yeah. Any other questions? Because we are a little bit over, but I'll tell you what, that was action-packed, and Cindy and I had talked about it. Certainly let me know. We're looking to do a series where we can drill down on 3 different sections of it and really get into some more point-specific and demonstrations and so on. Because let's if you're going to do your best, you got to be on target with this information. Obviously, the additional certification from Arthritis Foundation it would be an amazing step as well, and we certainly would accept that for CECs as well, because that's what it's about. But going forward on this, we have a lot of other things that we have ourselves as far as the senior fitness and the medical fitness specialists, because when you're getting into these chronic injuries, you need to know this stuff inside and out, and in particular, that one client becomes 5 clients, becomes 10 clients, because they're telling people about how much better you're making them feel and how their daily life activities now are functional and effective and a lot less pain-free. So, and who do they attract that to? It's you, because you were following some of these things that Cindy put out and used them. I've got a lot of things here, Cindy, popping up on amazing. Thank you so much. Love the wedge suggestion. Really love the webinar, Cindy. Info packed. It was info packed. That's what we're looking to do. The 2 or 3 series on the road here, and we'll get that out to you. So hopefully you can attend that and really drill down on some of these ideas. Thanks, Michelle, Bridget, and Lana, and everybody. Nancy, they're all saying that they love your passion and what you just delivered. So
Thank you so
everybody,
much.
thank you, Cindy. Amazing job, and everybody have a great weekend, and we'll look forward to expanding on this more the next time. Everybody have a great evening. Thank you.
Bye, everybody. Thank you, Jay. Thank you.
Thank you, Cindy. Bye.
Bye-bye.